Tinaway versus Quietus review. Effectiveness for tinnitus relief. Explain tinnitus sufferers often have specific concerns about supplement options and realistic expectations for relief. The following questions address common inquiries about Tinaway, Quietus, and tinnitus management in general. How long does it take for Tinaway or Quietus to work for tinnitus? Both supplements typically recommend allowing 3-6 weeks of consistent use before expecting noticeable results. Users who report benefits often note gradual improvement rather than immediate relief. This timeline aligns with the general understanding that nutritional supplements require time to build effective levels in the body and potentially influence neurological or vascular function related to tinnitus perception. Timeline: Tinaway user reports. Quietus user reports 1-2 weeks. Minimal changes. Some report slight reduction in tinnitus volume. Few noticeable changes. Some report mild calming effect 3 to 4 weeks. Some users report moderate improvement, particularly during daytime. Gradual improvement reported by some users, especially in stress-related tinnitus, 5 to 8 weeks. Maximum benefit typically reached with 30 to 40% of users reporting satisfaction. Maximum benefit typically reached with 25 to 35% of users reporting satisfaction. Beyond 8 weeks, limited additional improvement benefits plateau for most users. Limited additional improvement benefits plateau for most users. If no improvement occurs after 8 weeks of consistent use, it's unlikely that continued use will provide benefits. This pattern suggests that individuals should establish a clear timeline for evaluating effectiveness and consider discontinuing use if no meaningful changes occur within this window. For those interested in alternative approaches, exploring herbal remedies for tinnitus might provide additional options. It's worth noting that tinnitus naturally fluctuates in intensity, making it challenging to attribute improvements specifically to supplements rather than normal variation or placebo effects. Keeping a symptom journal before and during supplementation can help track actual changes more accurately. Can I take Tinaway or Quietus with my prescription medications? Both supplements contain ingredients that may interact with certain medications. Tinaway's ginkgo biloba can increase bleeding risk when combined with blood thinners like warfarin, aspirin, or clopidogrel. It may also interact with antidepressants, particularly SSRIs, potentially altering their effectiveness or increasing side effects. Quietus contains ingredients like vinpocetine that may interact with blood pressure medications and anticoagulants. Before combining either supplement with prescription medications, consult with your healthcare provider or pharmacist to review potential interactions specific to your medication regimen and health conditions. Why do some people get results from these supplements while others don't? The varied response to tinnitus supplements likely reflects the heterogeneous nature of tinnitus itself. Tinnitus can result from multiple underlying causes, including hearing damage, vascular issues, neural hyperactivity, or stress-related factors. A supplement that addresses one potential mechanism, like improved circulation from ginkgo biloba, may help individuals whose tinnitus relates to that specific factor, while proving ineffective for those with different underlying causes. Individual differences in metabolism, absorption, and the blood-brain barrier function also influence how supplement ingredients affect each person. Additionally, the placebo effect plays a significant role in perceived benefits, with factors like expectation, cost, and presentation influencing outcomes independently of actual biological effects. Are there any natural alternatives to Tinaway and Quietus? Several natural approaches may provide similar or superior benefits compared to commercial tinnitus supplements. Magnesium supplementation has shown promise for some tinnitus sufferers, particularly those with noise-induced hearing damage, with fewer potential interactions than multi-ingredient formulations. Melatonin has demonstrated benefits for tinnitus-related sleep disturbances in several clinical trials, improving both sleep quality and tinnitus perception. Vitamin B12 supplementation may help individuals whose tinnitus relates to deficiency, which is more common in older adults and those taking certain medications. These single-ingredient approaches offer greater transparency regarding dosage and potentially fewer interaction concerns. Lifestyle modifications represent perhaps the most effective natural approach to tinnitus management. Reducing consumption of tinnitus triggers like caffeine, alcohol, and high-sodium foods helps many sufferers. Regular cardiovascular exercise improves blood flow to the auditory system and reduces stress, potentially addressing multiple tinnitus mechanisms simultaneously. Implementing good sleep hygiene and using sound masking techniques at night often provides more consistent relief than supplements alone. Is tinnitus ever completely curable with supplements? Complete elimination of tinnitus solely through supplementation remains rare and unlikely for most sufferers. While some individuals report significant reduction in symptoms, complete cures from supplements should be viewed skeptically. Tinnitus typically represents a complex neurological adaptation rather than a simple nutritional deficiency, making it resistant to simple supplementation approaches. When tinnitus does completely resolve after taking supplements, it often reflects either coincidental natural resolution, correction of a specific deficiency that was causing the symptom, or particularly strong placebo responses. Most improvements from supplements are partial rather than complete. Realistic expectations include reduced volume or distress rather than elimination. Supplement benefits often diminish if the product is discontinued. Comprehensive management approaches typically outperform single-method treatments. Some cases respond better to medical interventions addressing specific underlying causes. Setting realistic expectations helps prevent the cycle of trying increasingly expensive supplements in search of a complete cure. For most individuals, successful tinnitus management involves accepting some level of tinnitus while reducing its impact on quality of life through multiple strategies, rather than seeking complete elimination through supplements alone. When evaluating any tinnitus treatment, including supplements like Tinaway and Quietus, maintain a balanced perspective that considers scientific evidence, potential risks, and individual factors. While these products may offer benefits for some individuals, they represent just one potential component of a comprehensive tinnitus management approach, rather than standalone solutions. Remember that tinnitus often improves over time as the brain gradually adapts through a process called habituation. Even without specific treatments, this natural adaptation process can be supported through sound therapy, stress management, and cognitive techniques with more reliable outcomes than supplement use alone. For those struggling with persistent tinnitus, connecting with support groups and tinnitus associations can provide valuable coping strategies and emotional support beyond what any supplement can offer. These communities offer practical advice based on lived experience and can help individuals navigate the complex landscape of tinnitus management options more effectively.